Flu season is upon us, and health officials say cases of respiratory illnesses are really rising across New York.
Already, both flu and RSV cases have spiked in the last week. Joining us right now with how you can protect you and your family is the New York City Health Commissioner, Dr. Michelle Morse. Nice to have you here.
Good morning.
Always good to see you.
So you see a spike already?
It is exactly the time of year where we see this happening. So we're, quite effectively right on time. In the past week, compared to the week prior, we've had a more than 80% increase in flu visits in the ER and a more than 60% increase in visits in the ER for RSV. So we're starting to begin the ascent of that curve that happens every respiratory viral season. The good news for New Yorkers, of course, is you can protect yourself in a safe and effective way and protect your family and your community with updated RSV, flu, and COVID shots.
Well, let me ask you something, because we were just reporting on this new strain of the flu out there, which this vaccine does not target.
So every year the flu strains change a bit. There's two big categories, flu A and B. That's pretty consistent. But each year we play kind of a epidemiologic science game to try to predict which flu strains are going to be circulating. So the updated flu shot really does try to match and predict what strain is going to be circulating. We aren't always perfect, but even if there are strains that were not expected, the flu shot that we are offering right now, this updated flu shot is still going to offer significant protection against the worst outcomes for flu. So that's going to the ER, being hospitalized, or death. And each respiratory viral season, we see upwards of 2,000 people who die from the flu, and that is totally preventable. So it's still worth getting the flu shot. It still offers protection, and the flu strains do shift and change, and then we try to match it with the vaccine.
So you're saying you don't have to necessarily hit the bullseye, but you're hitting the target.
That's well said. Yes, exactly.
All right, I'm done now. All right, so you talked about the spike in numbers of flu in the last week, more than 80%. RSV, more than 60%.
Yes.
COVID is back again. What is the difference when I'm sitting at home if I feel these symptoms, and does it really matter?
That's an awesome question. It's really important, actually, if you start to feel any viral symptoms, that you get tested, because we have rapid tests that can figure out, is it COVID, is it flu, is it RSV? And there are treatments, particularly for people who have medical conditions where they're at higher risk of complications from these viruses. You want to know, should you take Tamiflu? It's a medication to treat the flu. Should you take Paxlovid, which is a medication to treat COVID? So those treatments are accessible. They're very effective at keeping people out of the hospital, and nobody wants that in the middle of the season where you're traveling with family and want to be with friends. So it is important to get tested and figure out which one you have.
All right. I already got the flu shot, but there's a person on our staff. I don't know if he's scared or not, but I think, Dan, come on up here. Dan,
I'm not going.
Come on here, Dan.
Oh,
Well,
Dan,
the good news is you don't have to sit on anyone's lap to get this. We got your chair.
To get the shot.
Okay.
Hi, Doctor. How are you?
How are
Nice to meet
you?
you
You as well.
There's nothing to be frightened, right?
Not at all.
No.
It's a tiny little pinch. This is absolutely routine.
So why have you not gotten it yet? Just not time?
Yeah, I normally get it. Excuse me. I normally get it here.
Oh, this is not helping.
I was yelling at my son's football game this weekend. And I still have a little bit. Anyway, I normally get the shot here when they offer the free clinic, but I don't know, I just didn't have time to get it.
Yeah, which happens.
Yeah.
Yes.
Doctor, I have a theory about why this is like kind of the spike. The kids stay out too late on Halloween.
Oh,
They
that's
poison
fair.
themselves with all that candy. They get sick.
That's
then their
fair.
parents get sick. Then they bring it to work, and it's the beginning of the whole nonsense.
Thanks a lot, Dan.
That's
The
my
cycle
theory.
continues, 100%.
One of the key things, stay home. If you're sick, stay home.
Yes, that's a good
Exactly.
one.
Thank you for that.
Yeah,
That
all
is
right.
very important.
Okay, so
You
you're going to
interrupt the
administer
cycle.
the flu shot.
Yes, I'm just waiting for one
more glove.
thick
We got it.
glove. Thank you
Doc,
very
do you
much.
need an assistant? Because I play one on TV.
Don't let her give me the shot.
I got you.
Is this going to hurt?
Just
Yes.
it's a tiny little pinch. You're gonna barely even feel it. I can guarantee.
All right, I'm
Oh, look at
ready.
those
Dan's got a lot
tats.
of
Yeah,
tats.
really.
Whoa, something we just learned about Dan.
They said the left arm. I said, all right.
That's right.
That's what we're going to do.
Tiny little pin.
I'm going to keep talking.
There you go.
She gave the shot. I didn't even feel it.
That's
it.
it.
It's all right.
All right.
I survived.
Done.
And you're done.
I feel better.
And so
you
he's
go.
good till next year.
That's right. Exactly.
You know, one of the things we were talking about earlier is my doctor really encouraged me to get the pneumonia vaccine this year.
Yes.
First time ever that at least he's talked to me about it. I got it, and you say that it's effective. I didn't even tell me this.
Oh, thank you.
For the rest of your life if you get it.
That is exactly right. It's an incredibly safe and effective shot. It decreases your chances of having complications from pneumonia. And for most of the large majority of people, one shot and you're good for the rest of your life.
Wow, that's amazing. Can we talk about whooping cough?
Yes.
Because I think you've seen some of that going around.
That's correct, yes. Whooping cough is a bacteria, actually, and it's very easily transmissible. It causes pretty terrible cough symptoms, and it can make you feel terrible. Unfortunately, we have over the past year or so seen a slight increase nationwide in whooping cough. But again, it is vaccine preventable. We have a very safe, effective vaccine. It's called the Tdap vaccine. You can get it. Sometimes people get it if they've been exposed to tetanus or, you know, a nail or something like that. And that vaccine also prevents whooping cough.
Who's that for?
Everybody. Yeah.
Is it more for
Everybody.
kids who are sort of coming down with the whooping cough? I feel like that's a thing that the
So
kids will get.
kids, definitely, yes. It's a part of, you know, basically any kid's routine childhood vaccines. They should get the whooping cough vaccine.
Right.
And then for adults, every 10 years.
Is it a big deal here? Because I know I saw the numbers in Texas 4 times last year, which was 6 times the year before. It's spreading in the Midwest. Are we concerned about it in the Northeast?
So it's always circulating nationwide, an increase, not a massive change here in New York City, but the recommendation is still the same. Make sure you're up to date on that vaccine. And the other thing I think that's really important is as you get older, sometimes your immunization, your immune system gets weaker. So it's even more important, especially for the grandparents out there who are going to be around kids, make sure you're up to date on this vaccine. And there's no seasonality to it. That means, again, year-round, whooping cough is circulating.
Dr. Morse, since we're going to be your assistants, we realize you forgot something for Dan.
Oh,
yes.
no.
Oh, my
yes. I was
gosh.
wondering if I was
Look
going to
at-
get a lollipop.
Wow.
Oh, it's my
All right.
favorite flavor.
There you go.
Cherry.
You guys are really prepared.
You're such a good boy.
Thank
we
you,
appreciate
Kurt.
it.
We appreciate it. Thank you
Thank you,
very much.
Dr. Morse, for the information.
Thank you for having me.
All right. When we come back.